I'd like to call the April 26, 2021 special board meeting to order. And then just a second, I'm here doing it. We have a motion to have a suspension of the rules of procedure to allow attendance of the legislature telephonically and so move that from Mr. Akers and second by Mr. Reagan. All in favor?
Aye.
Opposed? Carried. Roll call, Kelly?
Reagan,
Here.
Forsythe,
Here.
Lightfoot,
Here.
Sheridan,
Here.
Smithers,
Here.
Denisha,
Here.
Perkins,
Here.
Akers,
Here.
Fay,
Here.
Haggard, Biacco,
Here.
Burke,
Here.
Arquette,
Here.
Terminelli,
Here.
Curran,
Here.
14 present.
Present, Legislator Margaret Haggard is called and she is not going to be able to be at tonight's meeting. Mr. Denisha, would you lead us in prayer? Follow the pledge of allegiance.
Dear Heavenly Father, this evening we thank you for the opportunity to gather here in your sight as citizens of our great and wonderful nation. Dear Father, we pray the dreadful pandemic that has gripped our nation will soon be over. Let us give thanks to those who have stood on the front lines helping to protect us. Let us remember those who have been lost. Let us give thanks for those who have survived. And let us recognize that there are no obstacles, large or small, that we cannot overcome when we work together. We ask that you grant us the wisdom to make the best decisions during our deliberations and the courage to stand behind them. When the evening's work is complete, please guide us on our journeys home and grant us all a safe return. For all these things, we ask your blessing through Jesus Christ, your Son, in whose name all things are possible. Amen.
Amen.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Need a motion to approve the agenda. Mr. Smithers, Mr. Spade makes a second. Opposed? Carried. All in favor?
Aye.
Carried. Motion to approve the minutes. Motion made by Mr. Perkins, seconded. Oh, excuse me, Mr. Second. Motion made by Mr. Perkins, seconded by Mr. Smithers. All in favor?
Aye.
Opposed? Carried. We have a COVID update. Dr. Williams, would you like to go first, or would you like to have Jolene go first?
If it's okay with you, I'd like to have Jolene go first, please.
Jolene? Okay, go ahead, Jolene.
Okay. Get my screen up. Okay. So, as of today, we have 7,208 cases to date. We are down to 3 current hospitalizations. We have 109 active cases and 7,003 individuals have completed isolations. We have had 96 deaths since last March due to COVID or COVID related. As you can see from the hospitalizations, we are starting to drop off, which is what we were hoping to see with the effort of the vaccination efforts. So that is good for our local hospitals and the community. With 1 day remaining in the reporting week, we've had 63 cases so far this week. Last week, we had 87 in the 7-day period. So with 1 day left, we are below that. Our average new daily cases is down to 10.5. Our average last week was 12.2. So it is starting to level out on a daily basis. Our school cases, though, are still continuing to be higher for our K-12 classes. Our monthly average per week, well, our weekly average per month in April was 21. Which was up from 12 per week in March. We've had 16 cases so far this week, and we still have tomorrow to report out on. Our college cases are going in the right direction. We are down to 7 this week. So they have been able to contain the outbreaks that were happening at the beginning of April. For our isolation and quarantine numbers, like I said, we have 109 actively on isolation and 563 people on mandatory quarantine. So we've put a total of 32,333 people have been through the isolation and quarantine process. And I just want to remind any mobile and seasonal businesses that are reopening to just make sure you're following up with your permitting office to ensure that you are compliant with all of the COVID regulations that may have changed since you last opened. So for a vaccine distribution update from the health department, so far our department has administered 4,719 first doses and 3,645 second doses. This week, we are doing our first community Johnson & Johnson clinics. We are at the Norfolk Fire Department, Fraser Winthrop Fire Department, Hopkinton Fort Jackson, and then we are doing the second doses at the Ogdensburg Free Academy. And then next week, we are going to be at the field house doing second doses, and we are working on setting up more mobile clinics for next week as well. A homebound update. So far we have vaccinated 44 homebound individuals with Moderna and 10 with Johnson & Johnson. So if you are homebound or you know anybody that is homebound and would like to receive a vaccine at home, please call our office at 315-386-2325, and we will put you on the list to get a vaccine. This past week, Thursday and Friday, we decided to try a new initiative, and we worked with the fire departments to do pop-up clinics. So you could make an appointment or you could walk in, and they were a huge success. These are the numbers that we ended up vaccinating at each of the different fire departments. So I do want to thank all of the fire departments for your willingness to help us with our vaccination efforts. It's been a great way to get out in the communities, to get to people that may not have been able to make it to one of our larger clinics or to a pharmacy or a state site. I do want to give an update. We were notified this morning that the state site at SUNY Potsdam, their last day for administering Pfizer is this Friday. So they still do have a lot of appointments available until that time, and you can either make an appointment or you can do a walk-in. I want to make sure that people understand, though, that this is the only option for Pfizer in the county. So if you are 16 or 17 years old and you have been just thinking about it and not really sure if you want to go get the vaccine, for right now, this is your only option. Beginning May 8th, the state site is switching to Johnson & Johnson on a walk-in basis. We will be working to come up with other Pfizer availability in the county. However, right now, there are no pharmacies that currently have it in stock. So if you want the Pfizer vaccine, please make sure you go by Friday. And then I just wanted to highlight, so the New York State did adopt the CDC choosing safer activities if you are fully vaccinated. So if you go to the CDC website, you can see what activities you can now do if you're fully vaccinated. without a mask. And it has a good visual aid for people on what is safe versus least safe, especially if you're unvaccinated still. And if you are fully vaccinated, what can you do now without a mask versus still needing a mask? And they have it split into outdoor activities and indoor activities. And as you can see, all of the indoor activities still do require a mask. And then if you were vaccinated out of state, say you got vaccinated in Florida or you were vaccinated through a federal program, your records will not be in the New York State system. So if you would like that to be recorded in the state system, just call the local, call our office and we can work with you to get it recorded in the system. And then for the legislators, I do want to mention, we did complete, along with all the other departments, our 2020 annual report. And it highlights all of the other programs that public health has worked on for 2020 while taking on the workload for the COVID pandemic response. It will give you a quarter by quarter snapshot of our budget, our accomplishments and challenges for 2020, along with what our focus is for 2021 for all of our other programs. We have struggled to hire nurses. We've had vacant positions since August. We still have 2 current nursing positions open. I do want to highlight that 1/3 of our staff are newly hired since January 2020. So it goes to show to their tenacity for not only learning their roles, but picking up COVID at the same time. We added a new section this year to our report for our Covert Grants, which is separate from our emergency preparedness program. And then we also included some statistics for the programs for previous years to show how COVID has affected our department. And I just want to state for them that I am very impressed with what our department has accomplished and maintained with the constant changing guidelines and demands of the pandemic. And as you will see, our department not only provided care 24 hours, 7 days a week for COVID, we also kept up with all of our other required elements for our 17 other programs. So I'm very proud of our department, especially given the small size and the staffing challenges in the pandemic, that the department has risen above and beyond to protect the community with public health. Ruth will be sending the annual report to your Google Drive tomorrow for your review. And I'm going to turn it over to Dr. Williams for his portion.
So good evening, everyone. Thank you, Jolene, for that update. So I was going to go ahead and give my portion of the COVID-19 update. So I'm going to start with the good news, and there's actually a bit of good news. So as everyone is probably aware, coming down from the peak of almost 300,000 cases per day, we're now at somewhere in the 40,000 cases per day as a country. And if you look at the trends, they're very favorable, right? So for the 14-day change, we've had minus 27%. And for hospitalized, also a decrease of 5%, remembering that the hospitalizations and deaths tend to follow behind the case numbers. So really favorable changes in almost every state in this country. So happy to report that. As far as vaccination on a national level, there have been more than 240 million vaccines administered. Keeping in mind that most of two of the vaccines require 2 doses, there have been 240 million total doses administered, which means that if you look at the percent of the population in the U.S., at least 44% of people have received 1 dose. Fully vaccinated is 31%. If you look at what's happening in our community, the total doses that have been administered is 84,000. And again, most of these are 2-dose vaccines. So if you look at the eligible population, and that's the people who are eligible based on age now to receive the vaccine, for the eligible people, we're at 50%, or really 51% if you round up, receiving at least 1 vaccine. However, if you look at the total population of the county, which is closer to 110,000, we're at 41.5% for a first dose. If you look at how this comes up by age, which I think is very important. Again, if you look at the 60 to 69, the green vertical bars represent the absolute number of vaccines that were administered, but it's the reddish pink line that shows the percent of people in that age group. So for 60 to 69, we're at 74%. For 70 to 79, we're at 84%. And for 80 plus, we're at 74% receiving at least one dose. So that's really excellent information. For the 50 to 59, we're at 53.7%. And then it goes down a bit, and then certainly lower for the 15 to 19-year-old group. So, there are a number of challenges. One of the things that's not a problem right now is the supply of vaccine. What's less of a problem is access to vaccine. Now, Jolene and the county have done an excellent job at sort of decentralizing vaccination. So getting to those fire departments, getting out into the community, I think has been awesome. So we've really worked on access. So that's less of an issue. But the increasing problem really is vaccine hesitancy. And so there's some interesting studies being published, and I wanted to sort of go over what I think are probably the 5 most compelling reasons that people should get vaccinated at this point if they're in that hesitant or undecided group. And really, I think the first reason is that the risk of complications from infection with a virus is far greater than any risk of side effects from the vaccine. The second reason is basically, and I'll explain this further, the vaccine primes the immune system, but then the vaccine leaves out of your body. You can't even detect the presence of the messenger RNA after about 72 hours. The virus itself, however, stays in your body for weeks. And in some studies, there's some people who have the virus in their body for up to 3 months. The third point I'll make is that 95% of doctors, both in our area, but also if you look nationally, we reviewed the evidence as physicians and we decided ourselves to get vaccinated. The fourth reason is that the more we vaccinate, I think everybody wants us to get back to normal, to get rid of the masks, to revive our economy, and also to reduce the damaging social isolation that's occurred. And the fifth reason is, we can save, there's different estimates out there, but probably the most consistent one is that if we really successfully reach herd immunity, we can save at least 125,000 American lives. So, we know that the virus has killed more than 550,000 Americans, and more than 500,000 Americans have died. But really, long hauler syndrome, I think, is maybe the strongest reason for many people to become vaccinated. The Washington University School of Medicine actually just published an important study where they looked at veterans, and they looked at about 80,000 veterans who had COVID. Many of them were not hospitalized, but what they found is that a huge number of them had these lasting symptoms. And this is a little small for people to read, but basically they saw like long-term side effects in pretty much every part of the body. So they had people who had acute coronary disease, so like heart attacks, heart failure, arrhythmias. They had a lot of mental health at a much higher rate for people who had COVID when they compared them to 5 million vets who did not have COVID, that were all sort of age matched and demographically matched. They saw an increased number of people with diabetes, just really across the board, all kinds of symptoms at a much higher rate in people who had COVID and survived COVID. The other thing that was I hadn't seen before, but is interesting and certainly concerning, is that when they looked at these vets, and keep in mind this is a specific population, it was predominantly male, so it's not something you can easily extrapolate to the whole population, but it's very informative. So after the initial infections, these people survived the initial infection. After 30 days, they found that the COVID-19 survivors had an almost 60% increased risk of death over the next 6 months when they compared them to the general population within that VA population. Now, we know that there are post-viral syndromes for other illnesses, including to a lesser degree influenza. When they looked at data for that, they showed that the COVID-19 survivors had a 50% increased risk of death when they compared them to flu survivors. and that there were about 29 extra deaths per 1,000 patients in those 6 months after surviving the COVID infection. So this was one study. It was within a particular population. There was another study that the CDC just published where they looked, and this was in Georgia, and they basically looked at what kind of healthcare utilization people who survived COVID had. And I believe these patients were primarily, if not, they were exclusively non-hospitalized people. So these weren't the people who were the sickest. And what they found is, and again, these people were not in the hospital, that 2 out of 3 of these people in the period of time from 28 days to 180 days after COVID infection required some kind of medical attention, often for a brand new problem. So this is just sort of supporting the idea that there's, COVID causing death, which is very concerning, but there's also a fairly large number of people who seem to have this long hauler syndrome or post-COVID syndrome. So what we do know about the vaccines is, as I said, more than 240 million doses have been administered to Americans. The vast majority of these people either have no initial side effects or mild to moderate transient reactions after vaccination. So that's the sore arm, a little fever, some muscle aches, which largely resolves within 24 to 48 hours. There are these extremely rare allergic reactions. The numbers are somewhere between 1 in every 2 million people. Those reactions are treatable, and now that we monitor people afterwards, it's pretty much unheard of for somebody to have anything other than a brief ER visit. We do know that the Johnson & Johnson vaccine is associated with this extremely rare clotting event. Overall, however, if you look at the millions of people who've had the vaccine, it's considered to be safe and effective. And after reviewing all the available information, the FDA recommended to continue its use. I should also mention, now that we recognize this as a potential side effect, it is something that can be treated. The European version of the FDA also reviewed all the data and decided to continue administering Johnson & Johnson. At the same time, the FDA and the CDC are very carefully reviewing everything with the Pfizer and Moderna vaccines, and they've reported no associated significant either mid or long-term reactions. And this is documented by multiple safety systems that are in place to keep an eye on. Again, when you administer 240 million doses of a vaccine and aren't having this problem, it should be very reassuring. So, when you're comparing the virus versus the vaccination, there's really no comparison. And, we have a virus that's potentially deadly. It's certainly potentially disabling with this long hauler syndrome. We know that it's unpredictable. So I think a lot of people think, well, I'm young and I'm healthy, I'll probably be okay. But again, the data suggests that though most young people do quite well with the acute illness, the number of people who are younger who have long hauler syndrome is significant. And again, it's disruptive. So if you get the virus, a lot of times you're out of work for a while. You're put in isolation. Other people around you are quarantined. So it can be very disruptive to you personally, to your family, and also to your occupation. If you look at vaccination, it's safe. It's highly effective, and that's been demonstrated now over and over again. It's free and it's accessible. And it's also business and work friendly, right? So if you're someone who employs people or somebody who's a worker, if you're vaccinated, even if you're exposed to somebody with the virus, as long as you meet certain criteria, you actually don't need to be quarantined anymore. So I think it's very helpful for staffing purposes. So again, with vaccination among physicians, so if you look locally and if you look nationally, there's 95% of physicians have voluntarily received the vaccination. And if you look at a group of professionals who are basically applied medical scientists, so this is what we do for a career. We look at evidence and then we decide the risks and benefits, and then we determine whether to administer a vaccine or medical therapies. People ask me all the time about, they have an illness, they come in and they say, well, what would you do, doc? Fortunately, I've been relatively healthy, so I don't have the diseases that many of my patients do. So I'm not, I tell them what I think I would do. This is a situation where we in the medical community were able to say, people say, what would you do? Well, 95% of us say we would get vaccinated, and we ourselves got vaccinated. One of the, things that people talk about is vaccines and, the vaccine is going to be in my system and it's going to alter my DNA and things like that. We've talked about this before, but I just think it's very important. So these messenger RNA vaccines, they deliver a message to your cells that are near the injection site. These cells then take this message and then create a spike protein. That messenger RNA basically primes your immune system so that it can create antibodies. These messenger RNA vaccines, they don't enter the nucleus of the cell and they don't alter the DNA. And they end up being removed by the cell's normal processes. And the studies show that basically after 72 hours, you can't even detect the presence of these mRNA vaccines in your body. However, they end up producing this long-lasting immunity because your body produces antibodies during that short period of time. If you look at the virus, however, it infects multiple cells. There was an excellent article that just came out that showed basically what it does to almost every single cell in your body. And this virus is very much present for 10 days in healthy individuals. But we see this with some frequency that up to 21 days, people are still shedding virus. We don't think it's contagious or transmissible to other people after 10 days, but people do shed the virus. And we have many cases where people are still shedding COVID virus from their body after up to 3 months. So if you're worried about the vaccine staying in your system, it gets in your system, it does its job, and it leaves. The virus, on the other hand, can really be there for quite some time. So as far as returning to normal, what we know so far is that certain things don't work. So what does not work is reopening your economy and businesses without adequate vaccination. And I think that's, right now it's a nightmare of what's happening in India, in Brazil, and actually many parts of South America. What does work is reopening businesses and the economy with adequate vaccination. I think Israel still remains the best example of that, but I would argue that the US is actually becoming a decent example as well. And what you see in Israel is that despite, there's a global increase in COVID, but in Israel, there's been a 97% reduction in cases. And they are using like a kind of a vaccine passport concept where, people are able to go to restaurants, to concerts, to sporting events. They're fully reopening schools, all because they have this very high vaccination rate. I think what we're seeing in the US is also largely attributable to the vaccinations that have occurred. Again, we just need to get to a higher number. So for some people, maybe the most compelling reason is that, while as an individual, vaccination is safe and effective, but for our community and for our country, vaccination is really critical. There are lots of numbers out there of people estimating how many lives could be saved. I think probably the best article I read was by some scientists from Harvard and Yale who got together and said they were estimating about 125,000 lives could be saved, of people not in the world, but just of Americans. So to summarize, I think there's really hopeful and encouraging news on the progress against COVID, both nationally and locally. And Jolene and her team are a big part of that, but so is everybody in the community. Well, here we go. So St. Lawrence, Department of Health is doing an excellent job with vaccine distribution and administration. And vaccine uptake is actually quite high in our community. I think if you look at our people over the age of 60, it's tremendous. I love to see, in the 70s and 80% in that population. But we really need to continue these vaccination efforts to reach herd immunity through vaccination. And so it's going to take the people who are in the 16 to 50-year-old age group. And again, I think the most important points are this idea that, the risk of complications from infection is much, much greater than any risk of significant side effects from the vaccine. The vaccine's prime our immune system, and then it leaves like after 72 hours. We know that the virus stays in your system for weeks. 95% of doctors, we looked at all the evidence. We're not just advising people to take the vaccine. We voluntarily received the vaccine ourselves as soon as it was available. The more people we vaccinate, the faster we're really going to get back to fully reopening. I think everyone is eager to get schools back in session, churches back in session, full bore, and vaccination is a key tool for this. And then again, we don't know exactly what the number is, but even if we could save 1,000 American lives, but if we can save 100,000, more than 100,000 American lives, I think that should be a compelling reason enough. So that's my presentation. Thank you.
Thank you, Dr. Williams. Are there any questions of Ms. Unger or Dr. Williams? Mr. Denisha, go ahead.
Thank you, Mr. Chairman. Not a question, a comment for Jolene. Jolene, I appreciate you adding the information regarding out-of-state vaccination records and seasonal businesses in your presentation this evening. And it was a question that I had, and thank you for following through.
You're welcome.
Any further questions? Ms. Kern? Go ahead, Ms. Kern.
Chairman. I just wanted to say thank you to Jolene. I really like the initiative of immunizations and the pop-up clinics. I think that sometimes some of these people that are wavering on, will I get a vaccine, won't I get a vaccine? It's all about that availability right then and there, or getting somebody to come to your house and give it to you. So I want to thank her for her initiative that she took.
Okay. Any further discussion or questions? Thank you very much, Dr. Williams and Ms. Unger, for your presentation.
Thank you. Have a good evening.
Thank you.
Kelly, do you have any communications?
I do. A thank you card was received from the St. Lawrence County Dispatch for the kindness and generosity of the Board of Legislators during National Telecommunication Week. A thank you card was received from Public Health for the lunch and support during National Public Health Week. And I do have one citizen participation to read.
Okay.
It was received through the public comment email from Janet Rich of Canton. And she wrote, "Shame on St. Lawrence County. Over 9 years, St. Lawrence County has enabled addiction, created more addiction, endangered the welfare of families for those you pretend to represent. St. Lawrence County craves the addicts from Puerto Rico, Albany, and New York City to fill the prisons without any thought of the actual destruction of our gorgeous county. Law enforcement has watched addiction grow for years. Law enforcement enables addiction for years, and law enforcement has endangered the welfare of all St. Lawrence County for years. Now you place the children in foster families outside St. Lawrence County. It seems prisoners are more important than taxpayers in St. Lawrence County. Our taxes are too high, and there's no growth in social services to handle the burden you placed on them. No services, no growth, just police. Police reform, internship with social services, and police contracts posted prior to signing. Greed, 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 greed."
Thank you, Kelly. Is there anyone else for citizen participation in the hallway or anything this evening? Okay. There's no. Okay, good. Go on to presentation resolutions. Mr. Lightfoot.
Mr. Chairman, I offer a resolution accepting a donation and modifying the 2021 budget for community services to purchase bicycle helmets for the traffic safety program. Move for its adoption.
Seconded by Mr. Akers and Mr. Fay. And Ms. Kern. Any discussion? I don't see any discussion, no hands up. All the roll call vote, please, Gil.
Denisha?
Yes.
Perkins?
Yes.
Akers?
Yes.
Fay?
Yes.
Fiacco?
Yes.
Burke?
Yes.
Arquette?
Yes.
Terminelli?
Yes.
Curran?
Yes.
Reagan?
Yes.
Forsythe?
Yes.
Lightfoot?
Yes.
Sheridan?
Yes.
Smithers?
Yes.
14 yes, 1 absent.
Motion carries. Mr. Lightfoot.
Mr. Chairman, I offer a resolution modifying the 2021 budget for community services for funding received from New York State Oasis to St. Lawrence County as pass-through funding to St. Joe's Rehab Center, and move for its adoption.
Seconded by Ms. Kern. Mr. Smithers. Any discussion? Roll call vote, please.
Perkins.
Yes.
Akers.
Yes.
Fay.
Yes.
Fiaco.
Yes.
Burke.
Yes.
Arquette.
Yes.
Terminelli.
Yes.
Curran.
Yes.
Reagan.
Yes.
Forsythe.
Yes.
Lightfoot.
Yes.
Sheridan.
Yes.
Smithers.
Yes.
Denisha.
Yes.
14 yes, 1 absent.
Motion carries. Resolution carries. Second, okay, let's go to Mr. Lightfoot.
Mr. Chairman, I offer a resolution modifying the 2021 budget for community services for funding from RFMH / Oasis, New York State Opioid Response Grant, move for its adoption.
Seconded by Mr. Akers and Mr. Smithers. Any discussion? Don't see any discussion. Roll call vote again, Kelly.
Akers.
Yes.
Fay.
Yes.
Fiaco.
Yes.
Burke.
Yes.
Arquette.
Yes.
Terminelli.
Yes.
Curran.
Yes.
Reagan.
Yes.
Forsythe.
Yes.
Lightfoot.
Yes.
Sheridan.
Yes.
Smithers.
Yes.
Denisha.
Yes.
Perkins.
Yes.
14 yes, 1 absent.
Resolution carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution modifying the 2021 budget for community services for the co-location program in the Department of Social Services, and move for its adoption.
Seconded by Mr. Perkins. Any discussion? Being no discussion, roll call vote.
Fay.
Yes.
Fiaco.
Yes.
Burke.
Yes.
Arquette.
Yes.
Terminelli.
Yes.
Curran.
Yes.
Reagan.
Yes.
Forsythe.
Yes.
Lightfoot.
Yes.
Sheridan.
Yes.
Smithers.
Yes.
Denisha.
Yes.
Perkins.
Yes.
Akers.
Yes.
14 yes, 1 absent.
Resolution carries. Mr. Lightfoot.
Mr. Chairman, I offer a resolution authorizing the chair to sign contracts for services for the preschool special education program in the Public Health Department, and move for its adoption.
Seconded by Mr. Smithers and Ms. Kern. Any discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution modifying the 2021 budget for the Office of the Aging for New York State Office of the Aging funding from the Consolidated Appropriations Act for St. Lawrence County, and move for its adoption.
Seconded by Mr. Denisha and Mr. Smithers and Ms. Kern. Is there any discussion? Don't see any discussion. I'll roll call vote.
Fiaco.
Yes.
Burke.
Yes.
Arquette.
Yes.
Terminelli.
Yes.
Curran.
Yes.
Reagan.
Yes.
Forsythe.
Yes.
Lightfoot.
Yes.
Sheridan.
Yes.
Smithers.
Yes.
Denisha.
Yes.
Perkins.
Yes.
Akers.
Yes.
Fay.
Yes.
14 yes, 1 absent.
Motion carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution proclaiming May as Older Americans Month with the 2021 theme being Communities of Strength, and move for its adoption.
Seconded by Mr. Denisha. Any discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Ms. Kern.
Thank you, Mr. Chairman. I have a resolution authorizing the chair to sign memorandums of understanding to establish the emergency shelters for the county animal response team. This resolution.
Okay. Any seconds? Mr. Akers seconds it. Any discussion? Yes, Mr. Denisha.
Yeah, just briefly, Mr. Chairman, as I'm sure everyone knows, DANC is, they're completing their rounds of hazard mitigation plans with the different townships within the county. And one of the questions that comes up on the survey is, do they have a means to take care of animals? So I think this resolution is very timely, that it addresses that.
Any more discussion? All in favor?
Aye.
Opposed? Carried. Ms. Kern.
I have a resolution authorizing the chair to sign a contract with the New York State Division of Homeland Security Emergency Services Office of Interoperable and Emergency Communications for a fiscal year 18 statewide interoperable communications grant, targeted grant, and modifying the 2021 budget for emergency services. And I move that.
Second by Mr. Lightfoot. And any discussion? All in favor?
Aye.
Opposed? Carried.
It's roll call.
Roll call. All right, we'll have a roll call vote. Excuse me. Go ahead, Glenn.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Diaco,
Yes.
14 yes, 1 absent.
Motion carried. Ms. Kern.
Mr. Chairman, I have a resolution accepting donations to be used towards the implementation of an additional K-19 equipment and training for the St. Lawrence County Sheriffs, and I move that resolution.
Seconded by Mr. Lightfoot and Mr. Arquette. Any discussion? Is this a roll call or is this, right, it's not a roll call?
No.
All in favor?
Aye.
Opposed? Carried. Ms. Kern.
I have a resolution, Mr. Chairman, authorizing the chair to sign a federal equitable sharing program agreement and annual certification report for the sheriff's office, and I move that resolution.
Seconded by Mr. Akers. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Ms. Kern.
I have a resolution proclaiming May 15th as Police Officer Memorial Day during National Police Week in St. Lawrence County, and I move that resolution.
Mr. White, he makes the second, so does Mr. Smithers and Mr. Reagan, Mr. Akers. Otherwise, and Tony Arquette. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried.
I have a dog problem for 2 seconds here. I have a resolution proclaiming authorizing the chair to sign contracts, requesting grant extensions for poll worker training and voter education, and I move that resolution.
Seconded by Mr. Smithers. Any discussion? No discussion, all in favor?
Aye.
Opposed? Carried. Ms. Kern,
I have a resolution setting a date for a proposed hearing on proposed local law. It just says B for the year 2021, allowing 12 and 13-year-old licensed hunters to hunt deer with firearm or crossbow during hunting season with the supervision of an adult licensed hunter. And I move that resolution.
seconded by Mr. Akers, Mr. Lightfoot, Mr. Denisha, Mr. Perkins, Mr. Forsythe, Ms. Diaco, Mr. Arquette. I think I got everybody. Did you have your hand up, Harry? Also seconded by Harry and also seconded by Jim Reagan and Dan Fay. Okay, did I miss anyone? Okay. How about some discussion? Anybody got any discussion on this resolution? No discussion? All in favor?
Aye.
Opposed? Carried. Unanimous. Ms. Kern,
I have a resolution proclaiming May 6th, 2021 as National Recognition Day for Nurses during National Nurses Week in County, and I move this resolution.
Mr. Lightfoot seconds, Mr. Akers also seconds, and Mr. Dan Fay. And is there any discussion? Oh, Tony Arquette also seconds that. Discussion? Anyone discussion? Okay, I don't see any discussion, so all in favor?
Aye.
Opposed? Carried. Mr. Akers,
Mr. Chairman, I offer a resolution modifying the 2021 budget for the Department of Highways for an increase in capital highway improvement program known as CHIPS funding. I move this resolution.
seconded by Mr. Smithers and Mr. Lightfoot. Any discussion? No discussion? Roll call vote, Kelly?
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Diaco,
Yes.
Burke,
Yes.
14 yes, 1 absent.
Resolution carries. Mr. Akers,
Mr. Chairman, I offer a resolution approving New York State Department of Transportation Supplemental Agreement Number 2 for construction inspection for the St. Lawrence County Bridge Preservation Project, 2 bridges, bid numbers 334980, bid number 3341-780, PIN number 775396. I move this resolution.
seconded by Mr. Denisha. Any discussion? Oh, Ms. Kern. Any discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers,
Mr. Chairman, I offer a resolution authorizing the chair to award and sign contracts for the St. Lawrence County Bridge Preservation Projects, Island Branch Road Bridge over Island Branch of the Oswegatchie River, bin number 334980, the County Route 27 Bridge over the South Branch of the Grass River, which is bin number 3341-780, pin number 775396, and modifying the 2021 budget for the Department of Highways. I move this resolution.
seconded by Mr. Denisha. Ms. Kern, any discussion? No discussion. We're gonna have a roll call vote.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Yafo,
Yes.
Burke,
Yes.
Arquette,
Yes.
14 yes, 1 absent.
Resolution carries. Mr. Akers.
Mr. Chairman, I offer a resolution modifying the 2021 budget for the Department of Highways for insurance recovery funds from a total dump truck. I move this resolution.
Seconded by Mr. Smithers and Ms. Kern. Any discussion? I don't see any discussion or hear any. Roll call, please, Kelly.
Curran,
Yes.
Reagan, Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Yafo,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
14 yes, 1 absent.
Resolution carries. Mr. Akers.
Mr. Chairman, I offer a resolution approving supplemental agreement number 1 with Barton Lejudas, DPC, for additional final design services for the Ready project at Northumberland Bridge, Street Bridge in the town of Morristown, bin number 33-41-380. I move this resolution.
Seconded by Mr. Lightfoot and Ms. Kern. Any discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution authorizing the chair to sign application documents in a contract with the New York State Department of Transportation for Bridge New York funding. I move this resolution.
Seconded by Mr. Smithers and Ms. Kern. Any discussion? All in favor? Opposed? Motion carried. Mr. Akers.
Mr. Chairman, I offer a resolution approving a supplemental agreement with Delta Engineers, Architects, and Land Surveyors, DPC, for construction inspection CI services for the St. Lawrence County Bridge preservation of 2 bridges, bin number 33-40-980, bin number 33-41-780, and pin number 77-53-96. I move this resolution.
Seconded by Mr. Smithers. Ms. Kern. Any discussion? No discussion? All in favor? Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution determining that the construction of the LaFavorite Road Snowmobile Bridge in the town of Russell in St. Lawrence County, New York, will not result in any significant adverse environmental impact. I move this resolution.
Seconded by Mr. Denisha. Any discussion? No discussion? All in favor? Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution authorizing the chair to sign an amended agreement with J. Sheen Contracting Corporation to relocate a temporary bridge from the Jones Road over West Branch to St. Regis River project to the LaFavorite Road over Elm Creek and modifying the 2020 budget for the Department of Highways. I move this resolution.
Seconded by Ms. Kern and Mr. Smithers and Mr. Arkwood. And we'll have a roll call vote on this.
Discussion.
Let's have discussion first. Discussion. Any discussion? We have Mr. Perkins.
I'll be abstaining due to employment.
Thank you, Mr. Perkins. So noted. Mr. Arkwood?
Thank you, Mr. Chairman. I just wanted to give kudos to Legislator Denisha. This was his idea, and it was a good one. And I think it's money well spent. It'll be returned to the St. Lawrence County coffers through the use of that bridge. Thank you.
Any other discussion? A roll call vote?
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Abstain.
Akers,
Yes.
Fay,
Yes.
Fiaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
13 yes, 1 abstain, 1 absent.
Resolution carries. Mr. Akers?
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with the Workforce Development Board to assign the task of the one-stop network operator to the WIO Finance staff member in the One Stop Career Center. I move this resolution.
Seconded by Mr. Smithers and Ms. Kern. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Mr. Akers?
Mr. Chairman, I offer a resolution for the approval of the issuance of revenue bonds by the St. Lawrence County Industrial Development Agency, Civic Development Corporation for Carson University. I move this resolution.
Seconded by Mr. Reagan. And Rita Kern? Rita Kern. Any discussion? Mr. Reagan?
Mr. Chairman, I'd just like to point out that this is an excellent example of how the St. Lawrence County Industrial Development Agency works with our colleges to help them financially by, in this particular case, get a lower interest rate on a loan that the Clarkson is taking to improve its facilities. That will help the college in its recruitment efforts and in upkeeping its facilities. And, Clarkson is one of the largest employers in St. Lawrence County. And it's important for county government and the Industrial Development Agency to work with our colleges to help them, especially during these difficult times. So I commend the staff of the IDA for their hard work, and thank you to the Board of Legislators for supporting this.
Any further discussion? If not, we'll have a roll call vote. Kelly? Two-thirds vote is required for approval.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins, Akers,
Yes.
Fay,
Yes.
Fiaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
14 yes, 1 absent.
Resolution carried. Mr. Akers?
Mr. Chairman, I offer a resolution authorizing the chair to sign a one-year contract extension with First Student Inc. for preschool special education transportation services. I move the resolution.
Seconded by Ms. Kern. Any discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers?
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with the Rowe Law Center of New York for indigent appellate representation. I move the resolution.
Seconded by Mr. Fay and Ms. Kern. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Mr. Akers?
Mr. Chairman, I offer a resolution appointing the risk manager as a corporate compliance officer for St. Lawrence County. I move this resolution.
Seconded by Mr. Denisha and Ms. Kern. Any discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers?
Mr. Chairman, I offer a resolution authorizing grade changes to the titles of Assistant County Attorneys for St. Lawrence County. I move this resolution.
Seconded by Ms. Kern. Any discussion? All in favor? Opposed? Carried. Mr. Akers?
Mr. Chairman, I offer a resolution adopting proposed local law A for the year 2021, a local law reestablishing the St. Lawrence County multi-use recreational trail system and establishing a trail permitting process. I move this resolution.
And it's seconded by Mr. Perkins, Mr. Arkwood, Mr. Denisha, Mr. Lightfoot, and Ms. Kern, and Ms. Fiacco. I think you've got everyone. Any discussion? Tony Arkwood, go ahead for the discussion.
Thank you, Mr. Chairman. I'd like to make a friendly amendment to this resolution, and it's under section 11, subsection 4. It's on page 50. It speaks to amendments, or I shouldn't say amendments. It speaks to exemptions, and it lists under section F, OH fees owned and operated by St. Lawrence County and used by the St. Lawrence County, the St. Lawrence County Sheriff, Deputy, the patrolmen, so law enforcement, emergency services, owned and operated by the police, again, operation. What I'd like to amend this to say is that it also will make landowners that have signed landowner use agreements with St. Lawrence County exempt from having to purchase a trail pass. I think that they're very generous in allowing us to utilize their land, and I'd like to, but at the very least, offer them a trail pass at the cost to enjoy the trail that they're helping us build.
Is there a second to that? Mr. Lightfoot seconds it.
Second also.
Do we need more seconds or just Mr. Lightfoot? Okay, Mr. Lightfoot seconds, Ms. Kern seconds as well. Any discussion on that amendment? All in favor of the amendment?
Aye.
Opposed to the amendment? Carried. Now, on the resolution, go ahead, Mr. Arkwood.
Thank you, Mr. Chairman. At the Finance Committee meeting, I believe it was Legislator Forsyth that had asked in Lewis County what they were experiencing for trail pass, income. And the research showed it over a 3-year period that they're averaging in and around $120,000 annually with the season-long pass or the 3-day. And that was also one of the ideas that I had heard in committee was to take a look at the amendment that I just proposed. I think it may have been Legislator Smithers that asked as well about snowmobiles having to pay the pass. That won't be happening. The passes for summertime recreation. The snowmobilers already participate financially in the wintertime activities through their registrations and through the trail granting process. So if I got that wrong, Mr. Smithers, I apologize. But I just wanted to address a few of the questions. I had the good fortune of enjoying opening weekend at Lewis County this past weekend. Myself and a number of other St. Lawrence County residents went to Lewis County, and we left behind a lot of revenue for the people there. And we much look forward to folks in Lewis and the surrounding counties doing that very same for us as we move forward with this local law. Thank you.
Okay, any other discussion? Mr. Lightfoot.
I'd like to be added as a co-sponsor, please.
Okay. So noted. Now we're going, Mr. Forsyth, go ahead, Dave.
Thank you, Mr. Chair. Tony, I'll ask you, has there been a goal set by the committee, the people involved with this, for what the ideal number of permits for St. Lawrence County to make this feasible and sustainable for long term? Any idea?
Well, there's been no real benchmark set at this time, Dave.
Okay.
That 120,000, we're trying to take a look at, our county versus Lewis as far as per capita, and things like that. Not, at least from what I'm seeing on the trails, on a weekend base over the last few years. I believe that we'll equal that or better. And again, that'll serve to I think what's very important is that the residents of our county realize that the money that's brought in through the trail passes will go directly back into the maintenance of the trail, the upkeep. And we have right now, we're looking into, how the administration of the trail passes will be in Lewis County. The first year they went through their chamber. And then over these last couple of years, they've been using the county clerk's office. But those departments will certainly will have a piece of that money because they're obviously helping us with it. But the bulk of the money outside of the administrational aspects will be going directly back into the trail.
Okay.
Any further discussion? Now we'll vote on the resolution as amended. All in favor?
Aye.
Opposed? Carried. Mr. Forsythe.
Thank you, Mr. Chair. I offer a resolution authorizing the filling of vacancies.
Is there a second? Mr. Burke seconds. Mr. Kern seconds. Mr. Dan Fay seconds.
Mr. Chair,
Yes.
I believe there was an oversight in adding the replacement position for the abolished or proposed abolished deputy county attorney. And if I could request that an amendment be made to add that position to the bottom of the list, as well as a date in the be it further resolved of May 14th.
Did everyone hear Ruth? And does someone want to put that in the form of a motion? Go ahead, Mr. Fay. Is there a second? The second is by Mr. Perkins. All in favor? No, excuse me. Any discussion, I guess? We go with discussion on this. Discussion? All in favor?
Aye.
Opposed? Carried. Okay. Now, I think we probably vote now on the original motion by Mr. Forsythe saying he wants to authorize vacancies. Do we want to now take a vote on that? Yes? On Mr. Forsythe's resolution? I'll signify by saying yes.
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 Opposed? You say opposed? Carried, Mr. Forsythe. You're authorizing filling the vacancies has been successful with an amendment. Oh, is that county administrator's report now?
A few items to provide you with an update. First up is COVID-19. We have extended meeting flexibility of the body of the Board of Legislators through May 25th. As it relates this month, Monday, May 24th will be finance. So typically what we've been doing is watching the executive orders, identifying if the date's been pushed out further, and then resuming those conversations. So at this point, if there's no objection, we'll bring that up at finance on May 24th with the expectation, unless it changes, and I'll bring that to you. We are monitoring cases and hospitalizations, looking now at a tentative reopening of our facilities now that everyone's back, all of our staff are back in person of June 1st. That would be the Tuesday following Memorial Day. And that will give us some time to monitor those cases, make sure we aren't seeing any spread in the workplace, and to welcome the public back at that time. The DMV is considering the opportunity to reopen a little bit sooner. However, the state is recommending security be placed in each of those locations at the county for the first few weeks. We have seen some disruption in the past month's time with folks who have been very frustrated, not only when calling on the phone, but sometimes also when appearing in person. So I wanted to make sure there's no objection. I'm going to look at a couple of options, but one would be we currently have a contract in place with Securitas. We're looking at that and potentially seeing what the implications are. We have not spoken with them yet. Certainly want to look at what our options are to ensure the safety of our staff. We don't know yet. As we see the cycles associated with expirations, we know that summertime typically is a very, very busy time for the offices. And so what we'd like to do is make sure that our staff feel safe. I know it's been complicated on the phone, but I think it brings it to a different level in person. So just wanted to make you aware of that. The courts will be back 100% on May 24th. We will not immediately be able to move into vertical security, though the locked office buildings have provided for that to a certain extent. So we'll be looking at what that is and when tentatively they're short staffing wise, I think about 3 FTEs at this point to be able to provide the necessary security. So we'll keep you updated on that. And then last, you should all have these nearby, the public health campaign of I Got My Vaccine Because. We'd ask that you fill those out and we'll share those with public health. Unless there's questions on COVID-19 update, I'll keep going. Okay. Last Saturday, May 1st, was the second anniversary of the passing of former County Clerk Mary Lou Rowe. At that time, we had collected some funds to purchase a tree to plant in her memory. However, we passed the first anniversary and couldn't gather to honor her memory because COVID had hit. So we have those funds tucked away, and upon further reflection, are interested now in the potential to purchase a bench to place at the new location on Court Street where the New York State driver's tests are being held. For as long as I can recall, we held the driver's test on Judson Street here across from the HB Smith building. With the congestion, with that being a bus stop, we have moved the driver's test now begin just at the edge of the parking lot. So if there's no objection, we'd like to utilize the funds we collected. There's just about $150 and the balance of that from the Employee Recognition Fund. And currently in that fund, which legislators contribute to, there's $5,822 available. I believe at least first glance, the bench would cost approximately $500. I did share with you some pictures of those placed in Hubleton. They have also a nice concrete pad underneath, but we would take a look at that and I'd get you some prices before we move forward. Is there any objection to moving in that direction and providing that as a memory for Mary Lou?
Great idea.
She'd probably be mad that we're doing anything, but just as an aside, something we'd be very proud to do for her. Tomorrow, we'll be holding the Vacancy Review Committee at 3:15. We have 2 legislators who plan to attend. We have 4 departments who are bringing forward 14 positions for consideration. And with regard to that, to the staffing piece and space, considering the significant number of positions that were recently approved for social services, the Buildings and Grounds Committee has met once. They will meet again next week. But conceptually, they support the idea of moving some of the social services staff out of Judson Street and potentially looking at the concept of a pilot in another community. So one of the challenges that we have is having our large number of social services staff located at Judson Street address. In this way, we would be looking to embed staff, children's services staff in the community on a trial basis. This pilot that we're looking at would conceptually be in Ogdensburg, where there's available space in a building we already rent. This would reduce potentially the stigma of social services by having folks out in the community. And certainly if we were successful, we may look to other communities that may be able to be a location for units of social services. So that's something you'll hear more about at Services Committee this month. We'll bring you an update on Family First, but also wanted just to make sure that you understood having at least the 17, of which there have been 3 hired, we will need some space available. And certainly with new staff coming in, the presence of those folks to get trained would be here in Canton. But the more experienced staff that would be able to be remotely placed with a supervisor would potentially occur in Ogdensburg if we can make that work. Questions?
So we have security in this building here. Would you not also have to have security if we move to Ogdensburg?
That would be for office space, at least as we're talking conceptually about it right now. It wouldn't necessarily be for visitation, which is why the security is in place over there.
Okay.
Okay. Also wanted to mention,
We're good.
okay.
Go ahead, Mr. Burke.
Ruth, is the remote working part of the consideration?
With regard to this staffing setup, John, it's not. However, these staff are already working in the field. So they have assignments that take them out of the office on a regular basis.
But didn't we, during the COVID, didn't a number of our staff work from home, Ruth? Even though they worked in the field, they reported to their job assignments from home, did they not?
That's correct.
Would that be would that be a potential solution to the space?
I think that's certainly something we could include in those conversations.
Right, and I think we also talked about that, Ruth, with community services as well. Have you had an opportunity to explore that further?
We continue to talk about it, but we have not moved forward in a policy direction yet, awaiting some other issues to be resolved.
Mm-hmm. Well, I, for one, certainly encourage it. I think it's, I think if we can serve our constituents as well and perhaps even better by thinking outside of the box, I think we should do it.
Legislator Fay.
I'd just like to comment on today. I had to get some commercial plates at the Department of Motor Vehicles, and they professionally and quickly served me.
Great, thank you for the feedback. Just a couple of other items, Bill.
Legislator Forsythe.
Thank you, Mr. Chair. Ruth, my question's for you on the DMV issue. You said there was some disgruntled individuals or scenarios. Are you talking security for all locations? And is it just because of mask wearing? I read a couple of the North Country Now articles. Is it just for mask wearing or what's the issue you see with the security?
No, not so much on the mask wearing. The state DMV has recommended to county clerks that as they proceed in the reopening, that they have security present just to keep order, not for COVID-19 protocols. And we would be looking, Dave, at the potential of about a 30-day period just to get back into the swing of things. I think there's potential for the volume to be significant. I believe that other counties who may not be looking at reopening also may be directing folks our way. And I think being able to manage those, the volume of folks who may be coming would be really important.
Okay, and one other question, just follow up. If someone tried to walk into DMV without a mask on, are they allowed in and are they allowed to conduct business?
I believe mask wearing is recommended. I do not know if they are sent away. I can find that out for you.
Okay, I'd be curious. Okay, thank you.
Yep, I'll get back to you. Just a couple of other things. A few weeks ago when we honored our dispatchers, there was a request made to provide them with plaques. I just wanted to give you an update that unless there's an objection, we will place the order for the plaques, and we're looking at approximately $170 associated with providing those to our dispatchers, and we would be using funds from the Employee Recognition Fund, unless there's an objection.
Mr. Reagan.
First off, we thank you for doing that. I think it's the least we can do for these employees. On another related subject to what you were talking about just before, I think we should look at ways to encourage the public to renew their registrations with our county DMV office. When people receive their information from the state, it's all aimed at getting them to send it in to New York State. And I think, I've heard from some people who have done that, sent it in to New York State instead of bringing it to one of the local DMV offices, and they can't get any response from the state of New York as to what's happened with their renewals. And I think, even though the state is trying to get people to send them into Albany instead of, or to Utica, whatever, instead of to St. Lawrence County, we need to remind our residents that we have that service available right here, and our local DMV offices are very responsive. They'll be able to find out what happens with them. They're usually able to get very quick returns on their renewals, on their registrations, and if a problem occurs, our DMV people are great at addressing those problems. And I think, a lot of the public is forgetting that it's important for them to renew their registrations here at the offices that we have in Governor, Messina, Ogdensburg, and Canton, in order to keep that revenue, keep a larger share of that revenue here in St. Lawrence County. And plus, if a problem develops, they'll get a much quicker response from our people than they'll ever get from the folks in the state DMV, if they ever do get a response.
Absolutely. And I think certainly, as I mentioned, coming into the time where more renewals will be coming due, I can work with Sandy to get the word out. We've often put out extra press releases around that time. But also one of the initiatives I think that we learned through COVID was the drop boxes. And Sandy's working to get drop boxes at all of our offices so that even off hours, or if you get there just after 4 or 5 or whenever they close, you're able to make sure you can still do the business you need to do. So happy to follow up on that. Just a couple of other things, if I could. Oh, Rick.
Ms. Burke.
I just wanted to talk about the DMV. I've got a registration coming up due. I keep getting an email notification. Seems like I remember in the past, I used to get a registration renewal from the county DMV, and I would mail it back. I don't see that yet. Is that something they're still doing?
I can find out.
Because, if they're not, like myself, it's easy to do it online, but I know that I want to come here.
Yep.
And it'd be nice if other people had that option. They see it, they'll put it in mail, come right to the county.
Okay. See what I can do.
Thanks.
Wanted just to update you, we met, Chairman Sheridan and I met with the city of Ogdensburg last Thursday with the mayor, the city manager, and the deputy mayor. We were provided a tour of some of their contaminated parcels. And next week, my hope is at operations to bring you an update on the consolidation committee efforts. With regard to the public health director search, thus far, we have 6 individuals who've sent in their application for consideration. 5 of those have been credentialed, so we'll keep you updated. That group will also meet on Thursday this week to go over things. And my hope is that we'll also have our Axelon recruiter sending us applications by that time. So we'll keep you updated on that. Later this week, also, I'm going to meet with Captain Boyer of the State Police. We are in year 2 of the 5 renewal options associated with the lease. This year, it's 28 years that we've had shared space at the Public Safety Complex. And annually, we like to meet and go over things and make sure that the services provided by the county meet the needs of the state police. But also, as of last year with COVID, we didn't have an opportunity to do that. At Finance this month, we plan to bring you the lease associated with 206 Ford Street. We're working through some final language on that. And next week, the Buildings and Grounds Committee will reconvene on Monday, talking over the priorities established with regard to public safety and the dispatch resolution you approved with regard to the upgrades associated with that, the former correctional facility, our old jail, the highway outpost projects, but also looking at some policy recommendations that may be taken up. So we'll bring you an update on that. And last week, I reported out to you that we received $100,000 from a 2018 request for plow truck. This week, we are hearing that we may see movement on the $50,000 associated with the courthouse doors that were replaced several years ago. So very encouraged by all of that. Unless there's any other questions, that's all I have.
Mr. Light, or excuse me, Mr. Denisha.
Thank you, Mr. Chairman. Ruth, I know this is, probably should be asking Andre this, but I saw an article in the Watertown Times yesterday that said the Lewis County was going to be reopening their congregate dining. This morning, when I was on my meal route, I had a resident say, hey, this is great. I hear that St. Lawrence County is going to be reopening the congregate dining. And I said, where did you hear that? And he told me read it in Watertown Times, which obviously was Lewis County. And I told him that we had not made any plans yet in St. Lawrence County. But that's why I bring the question up. Are you aware of any thoughts? I know Office for the Aging was strapped for staff. Have any conversations taken place?
Many conversations have been taking place, and they have already done some assessment and associated with the modifications that would be necessary. Those modifications haven't been made yet, but they are looking at how they might do that safely.
Okay, thanks.
Okay. And I do also have an update from our county clerk. As you know, department heads are watching online. She indicated they'll make accommodations for those who cannot wear a mask, but for health reasons, they do not serve customers who do not wear a mask. They may choose to use the drop boxes. Okay. Any other questions?
Any other questions of Ruth? Thank you, Ruth. We'll move on to old business. Anyone have any old business to come before the board? How about new business? Any new business? Okay, none being mentioned. We'll go to committee reports. Are there any committee reports that you would like to give tonight? Ms. Curran, go ahead.
I attended the inter-county meeting a couple of weeks ago. They had an extensive discussion about the plans in New York State for getting to 5G. Some of the funding has been changed, and they're trying to get money sent to us so that we can upgrade our areas, because we're not as densely populated as some other areas. There's areas that have been actually skipped over. So they are making a list of that and trying to get people to try to fill in our spaces up here. Many places here have 3G when a lot of the state has 4G. And now they've decided to go to 5G. So we need a lot of upgrade to get from 3G to 5G. So they're working on getting a report to the state on exactly what we're missing.
Okay, thank you, Ruth. Any other reports? Excuse me. Yeah, Rita, I meant, excuse me. Any other reports? Yes, go ahead, Mr. Burke.
Not a report, just a question. It was my understanding with the 5G that there has to be more towers, more cell towers, and because the distance with the 5G, it doesn't travel, you don't get the same spread that you get off from 3G. Maybe I'm wrong, but I'd be interested in hearing if anybody knows the answer to that.
Can I answer that?
Yes, go ahead, Mr. Kerr.
That is part of our problem. And that's why they're making a list of where our spaces are. That's what our spaces are, is when we were supposed to go from 3G to 4G, we were supposed to get more towers and more infrastructure to be able to spread the 4G. The problem is because we never got to 4G, they just skipped to the next thing and said, oh, 5G, but they still haven't fixed the spaces that we have that don't allow us to have 4G. That's why they're kind of going back through the plan again, because we have a lot of spaces.
Any other questions of Rita? Okay. Ruth, is there a need to go into executive session?
Yes, sir, there is, for litigation, for personnel associated with the medical, financial, or credit or employment history of a particular person or corporation, or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation. Litigation and appointments.
Is there a motion to go into executive session? Mr. Akers, Mr. Fay, Mr. Lightfoot seconds. All in favor of going into executive session?
Aye.
Opposed? Going into executive. You're all set. Okay, Mr. Lightfoot, you have any comments?
Yes, sir. The first appointment is to the Community Services Mental Health Subcommittee expiring December 31st, 2024. Sarah Gordonier, Ogdensburg, New York. The second is for the Office of the Aging Advisory Council, term expiring May 3rd, 2024. Barbara McBurney, Parrishville. Marjorie McCullough, Hammond. The third appointment is to the Youth Advisory Board, the term expiring May 3rd, 2023. Adam Simmons from Canton, New York, and Rebecca Zulsdorf, Canton, New York. I move for their approval.
Is there a second? Mr. Perkins makes a second. Any discussion on those appointments? All in favor of those appointments?
Aye.
Any opposed? Carried. Ms. Kern.
For Environment Management Council, terms to expire 4/5/2023. I have Lucas Hands of Hanawa Falls, Stephen Manders of Canton. For the Fire Advisory Board, terms to expire 2/28/2024. I have Darren Bullard from Cranberry Lake, Steve Wilson from Brazier Falls. And then as a reappointment to the Environmental Management Council, I have Brian Washburn from Canton, New York.
Okay. Has it been seconded? Who would like to second? Mr. Denisha makes it second. Is there any discussion on any of those appointments? All in favor?
Aye.
Opposed? Carried. Mr. Akers?
Mr. Chairman, I offer for appointment to the St. Lawrence County Trails Advisory Board, Matt Brown of Canton, Kermit Blanchard of Potsdam, Danny Collins of Hanawa Falls, John Glasgow, also of Canton, Janice Lutz of Governor, and Spencer Thew of South Colton. These terms are to expire on 12/31/2023. Also, I have for the Workforce Development Board, Yoan Huey of Messina. And for reappointment to the St. Lawrence County Industrial Development Agency, I have Lynn Blevins of Ogdensburg. I would move these for appointments.
Is there a second by Mr. Smithers? Any discussion? Those names? All in favor? Opposed? Carried. For chairs appointments, I have 3 names that I would like to appoint to the St. Lawrence County Snowmobile Association Oversight Committee. Legislators Larry Venetia, Tony Arkwood, and Rick Perkins. And I think I probably need a motion to approve those 3 appointments, or?
No, you don't.
Not?
You don't. Chairs appointments, you don't.
I don't need it. Okay, that's good. All right, so there's no more further business to come before the board. I move to adjourn.
Second.
Who makes the motion? I moved, I guess it's Fred, I moved to adjourn, you second. Greg, seconds, all in favor?
Aye.
Adjourn.
Good night, everyone.
Good night.
Night.
Thank you.